Hi, everyone, and welcome to week 2. This week we'll be covering chapters 3, 4, and 5. However, online we're really going to be focusing on healthcare. This week's online assignments include a quiz on chapter 3 and 5. Now, that quiz you can take unlimited time, so feel free to take it as many times until you receive 100%. You have a break a leg assignment, your discussion board, and your reflection journal. I just want to exit out of here really quick to show you the break a leg assignment. And so here we have a scenario about poor Barnaby Wild who broke his leg. And so what you're going to do for this assignment is you are going to calculate the out-of-pocket costs for his family based on different insurance providers. Now, this first example here is an example. So you can see how they calculated the out-of-pocket costs, right? So here's the insurance information, and here's how the calculations were made. For this, you're going to do it on your own. So show your work here. Type in just like they did up here in the italics, how you came up with those numbers, and you would put the total amount here. Now, there are 3 different calculations you will use with the same scenario. And then over here under Ailing Amy, here is her insurance information. And you're just going to read the directions here and type in the answers down here. Don't forget after you've typed in your information to save the document. If you don't do that, you will submit a blank document. Let's go back to our PowerPoint. So this week's objectives include learning how healthcare is paid for in the U.S., understanding why healthcare status in the U.S. ranks far behind other nations, identify different healthcare programs, insurance coverage, and other resources that are meant to serve low-income communities. And finally, as you can see from that assignment, is to help you understand how to calculate healthcare costs. The U.S. is the only large industrialized country that does not utilize universal healthcare. And universal healthcare is described as a system that provides healthcare for everyone using tax dollars. So why is healthcare so expensive in the United States? Well, first, as our population continues to increase, more people are using health services. That makes sense. The more people, the more expensive it's going to be. Second, our life expectancy has increased. And so with that comes the need for more services, prescription drugs, and health technology later in life. As one ages, they require more services in regards to their health. And then last is that U.S. services just cost more money compared to other countries. The same service in other countries is significantly less expensive compared to the U.S. So how is healthcare paid for? Almost half of all healthcare in the United States comes from local, state, and federal taxes. The other half is made up by health insurance. When we look at the goal of health insurance, it is to spread the financial risk for an unexpected health event across a large group of people. It works under the same principles as auto insurance. Now, health insurance in the U.S. can be offered by an employer or can be purchased privately. I'm not going to go over all the health insurance terms in this PowerPoint, but I wanted to show you where to find it in Blackboard. When you enter Blackboard, you go to our Learning Module tab. We are in week 2. And if you scroll down a little bit, it is right here, healthcare terms and definitions. So please make sure you review that document. There are different health insurance plans in the U.S. One is a PPO, which is for a preferred provider organization. Under this plan, it offers more extensive coverage for services of healthcare for providers who are part of the plan's network. There is still some coverage for providers who are out of network, but generally is more expensive. A PPO generally offers more flexibility, but premiums and costs tend to be higher. An HMO stands for Health Maintenance Organization. Now, this offers healthcare services only with specific providers. Generally, how this plan works is you choose your primary care doctor or physician, and this is your main provider. You will go to him or her anytime you experience a health problem or for preventative care. If it is deemed necessary to see a specialist, you still have to go to this doctor first, your primary care physician, who will then select a specialist for you and write a referral for you. The last is a health savings account. This is an account that helps you save for future medical costs. Money put into this account is not subject to tax, and funds can build up and be used year to year. However, if you choose this account, you must have a high deductible health insurance plan coupled with it. And lastly is a flexible spending account, FSA. It is set up through an employer, and it lets you set aside pre-tax money for common medical costs and dependent care. And so what this means is that the money is taken out of your paycheck before taxes are collected. You only decide a certain amount per year, and if you don't use it, you will lose it. So you have to be sure to plan quite carefully with this plan because you don't want to lose that money. But a few common qualified costs include co-pays for doctor's visits, hospital fees, medical tests and services, physical rehabilitation, dental and orthodontic expenses, inpatient treatment for alcohol and drug addiction, vaccines and flu shots, as well as prescriptions, and some even over-the-counter medications. There are a few government programs meant to assist with healthcare costs. They are Medicare, Medicaid, the Children's Health Insurance Program, also known as CHIP, and the Health Insurance Marketplace. We'll go over these in a minute. Medicare is a federally funded insurance program that provides universal medical care for the elderly. And there are 4 parts. Part A is automatic. People are automatically enrolled in it once they turn 65. And it covers hospital care, skilled nursing facilities, hospice care, which is end-of-life care, and home health care. Medicare Part B covers physician services, outpatient care, and preventative care. Now this you would have to enroll in. It's not automatic. Part C is also known as Medicare Advantage plans. It's offered by private health insurance plans and offers extra coverage. Again, you would have to enroll and pay for this one. And Part D is insurance for prescription drug coverage. Again, you'll have to enroll in this and re-enroll in it each year. And there is also a payment for it. Medicaid is the largest source of healthcare in the US. Again, it's funded by federal and state governments. And it's really designed to help low-income families and individuals, pregnant women, seniors, and persons with disabilities. The conditions with Medicaid are different for each state. The Children's Health Insurance Program, or CHIP, is funded by both federal and state, so therefore it's different by each state. And it's really meant to serve children whose family income is below 200% of the federal poverty level is what it qualifies for CHIP. And I will go over the federal poverty level in a few minutes. And then finally, we have our health insurance marketplace, which was established by the Affordable Care Act, the ACA. And it's meant to help individuals and small businesses buy affordable health care. So when I mention the federal poverty level, this is what I'm referring to. It is a number set by lawmakers to determine what it means to live in or at levels near poverty. Different levels are used to determine the eligibility for state and federal programs. So for example, I mentioned that Children's Health Insurance Program eligibility level is 200% of the federal poverty level. And here's what that looks like. So this is a guideline for 48 states and the District of Columbia. There are different ones for Alaska and Hawaii. And these are 2020 numbers. So for example, at 400%, which is what qualifies for at the FDL, a family of one would need to make $51,040 or less to qualify. If you're a family of 8, that would amount to $176,000. And then 100%, so the federal poverty level are these numbers. So you're considered at or below poverty if you are one person that makes less than $12,760 per year. So these are just some of the numbers that help determine different qualifications for poverty levels in the United States. And lastly, I just want to mention the role of CHWs in healthcare. And here are the ways that CHWs help reduce costs of healthcare, but also improve health outcomes among individuals and communities. So they can provide outreach to help communities understand and access healthcare, help link people to healthcare services, and follow up to help clients understand their health issues and treatments, provide health education, assist clients in enrolling in healthcare programs. There are many individuals and families that don't understand that or don't realize that they could be covered under state programs. And then lastly, assist clients on how to access those health providers, which is very important. This concludes the PowerPoint for week 2. Have a wonderful week. And as always, if you have any questions, feel free to reach out to me.